Hello, I'm Dr. Russell Fry, and I'm one of the ophthalmologists at Metrolina Eye Associates. I just want to take a few minutes to tell you about some of my special interests, as well as to tell you a little bit about our practice here. I am the eyelid surgeon here at Metrolina Eye Associates, and the surgical procedure that I perform most often is a blepharoplasty. Now, blepharoplasty literally means to reshape the eyelids, and it's performed for both medical and cosmetic purposes. Now, the primary indication for a medically necessary blepharoplasty is a condition known as dermatochalasis. And dermatochalasis is a condition in which excess skin on the upper eyelids weighs them down and stills a patient's peripheral vision. In more extreme cases, that excess skin can rest on the eyelashes and push them down into the visual axis, sometimes leading to a more extreme condition known as entropion, where the upper eyelashes actually rub the front of the eyes and cause quite a bit of serious discomfort. The procedure is performed here in our office, and local anesthesia is all that we need to use. The patient arrives here about 30 minutes before we plan on beginning the procedure, and they're given some medicine by mouth to help them relax. And they wait here in this room in the comfortable recliners where they can watch television. We have some juice and some snacks, and they give the medicine some time to work. Once we've had an adequate amount of time for the medicine to take effect and the patient to feel a little bit more relaxed, we take them down the hallway and introduce them to our procedure room. This is our procedure room where the blepharoplasties are performed, and the patient will sit in this surgical chair, and it reclines into pretty much a flat space like a bed. And once we're in the room and in the chair and in proper position, the outlines of the excess skin on the upper eyelid are marked with a small little soft skin marker. This is to help us plan for the incision in order to remove this excess skin. Following that, a small injection of some anesthetic is applied underneath each upper eyelid in order to ensure that the patient's comfortable and pain-free for the rest of the procedure. And after that, the excess skin and fatty tissue is surgically removed from the upper eyelid, after which we use some cautery, which is just high heat, to stop any bleeding that may occur, as well as to really tighten up the connective tissue that's underneath the skin. This is a key step because it really ensures a nice natural contour, and it's an important step to try to prevent recurrence of the condition. After this, it's time to close the surgical incision, and a few sutures that dissolve are used to reattach the muscle layer, after which some non-dissolving sutures are used to repair the skin. After this, some ointment is placed on the incision, and the patient is given a cold compress to keep over their eyes. They'll see me back in about 10 days to get these sutures removed from the skin. One of the most frustrating problems for many of my patients is dry eye. It can lead to some chronic discomfort and poor vision, and many times the eye drops that are available over the counter just really don't provide adequate relief. I have a wide range of therapy to offer many patients that they may not be aware of. The first level of treatment is a variety of eye drops that are anti-inflammatory or antibiotic eye drops that are available by prescription only. And then in addition to the prescription only eye drops, there are a couple of procedures that can be performed in the office that can actually lead to a great deal of relief. One of those procedures is called punctal occlusion. And for some people that just simply don't get enough relief from the drops, either over the counter or prescription, very small plugs are placed in the drains in the lower eyelids, which carry the tears away. This procedure is painless. The plugs are generally not seen or felt, and most insurances, including Medicare and Medicaid, do pay for the plugs. In cases of more severe dry eye, I have a device here which is called intense pulse light, or IPL for short, and it's extremely effective in patients with severe dry eye, particularly dry eye that's associated with excess inflammation. And this device is actually on the cutting edge of dry eye treatment nationally, and we're proud to be one of the few institutions that can offer it. Another area in which I have interest is glaucoma. Glaucoma is a condition in which the optic nerve cannot tolerate the pressure inside of the eye, and it leads to a slow progressive death of fibers in the optic nerve. Patients who have glaucoma or at risk for glaucoma require regular thorough examinations. Anyone with a parent or sibling who has glaucoma is at excessive risk for developing glaucoma. Patients with glaucoma are often frustrated by the number and frequency of eye drops that they have to use. I empathize with this, and I offer a very straightforward, painless procedure that can be performed in the office that can either decrease the number or entirely eliminate the eye drops that a patient has to use for their glaucoma. Another health issue in which I take special interest is diabetic eye care. In our community, there's absolutely no reason that someone should allow his or herself to go blind due to complications of diabetes. I pride myself in providing thorough examinations for the early detection and treatment of vision-threatening complications of diabetes.